Hi everyone, Dr. Oliver here. I will be discussing the topic of how to present a patient case to your preceptor. So feel free to message me with any questions after listening to this presentation. The skill of case presenting is very important for nurse practitioners to master. Do not be discouraged if you struggle with this at first. This will come with practice. The purpose of a case presentation is to convey appropriate, concise patient information so that a patient receives the best care possible. This also allows a preceptor to determine your level and understanding of certain patient encounters. This allows a great opportunity for continued growth. The average length of a presentation time is about 3 to 7 minutes. This can vary from student to student and also patient to patient. Some patients will come in and they'll have a lot of different things going on with them, and then other times you'll come in and you'll have a patient that's just coming in for just a yearly checkup and they won't have much going on. So it really just kind of depends, but the average length of time is about 3 to 7 minutes. A good case presentation will allow for timely, thorough care, as a physician will not need to read through every detail in a patient's record to care for them properly. In the future, this allows for continuity of care, especially when referring a patient to a consultant. The components of a case presentation are very similar to that of a SOAP note. They should look familiar to you. Included components are introduction or patient demographics, history of present illness, physical examination, diagnostic studies, differential diagnosis, management, and then a summary of the discussion. The introduction portion should be brief and concise. Think of your patient demographic and chief complaint section of your SOAP note. This lets your preceptor know why the patient is here. This should be about 2 to 3 sentences in length. An example would be, patient is a 30-year-old Caucasian female here today with complaint of left lower quadrant pain for 4 days. Patient gives her own history and is a reliable historian. I think it's important to say that the patient is giving her own history and is a reliable historian, because if she is not familiar to your preceptor, and if someone comes in and you're questioning whether they are able to give a reliable history, this is a very valuable piece of information, because you may need to gather information elsewhere to make an accurate diagnosis and to formulate an accurate treatment plan. So just keep that in mind. The history of present illness section should be similar to the HPI in a SOAP note. However, in a patient case presentation, it will also contain the information from the patient's past medical history, past surgical history, family history, and review of symptoms if they are pertinent. So think old carts. You want to give me as much information to describe the patient's chief complaint. An example would be, patient complaining of left lower quadrant pain that started 4 days ago. Patient states that pain is sharp, rating it a 9 out of 10 at its maximal point. No prior history of left quadrant pain. States that pain comes and goes without any specific aggravating factors known. States she has been taking Tylenol as needed but doesn't think it's helping. Patient states she has soft formed daily stools that have not changed from her normal. She denies having fevers, no recent travel or illness. States this is affecting her life as she has had to call off work twice due to pain. No ER visits for this complaint. So again, just nice and to the point, but also contains a lot of information to paint that picture of the patient. The physical examination is similar to the SOAP note version. However, it is in an abbreviated form. You will include pertinent data that is helpful towards making a differential diagnosis. An important piece to note is a patient's general appearance. Does the patient appear to be in pain? Then you can go on to state that the patient's belly is soft, bowel sounds are present, tenderness with deep palpation to lower quadrant is noted. The diagnostic studies section of the patient case presentation is an important piece. It is important to think of what is pertinent to make your case. You can include imaging studies, blood work, urine studies, etc. Continuing with our example we have been using for left lower quadrant pain, an example could be CBC showed no elevated white blood cell count, patient had a colonoscopy 2 years, that was normal, hemoglobin is 10.9, and occult stool is negative. It is important to remember to include pertinent, positives, and negatives. So pertinent meaning that information that will make your case for a certain treatment plan over another. This will give a good picture of what's going on with the patient. The development of differential diagnosis will be a new skill for each of you as you start out in your clinicals. We will go more in depth with how to develop a differential diagnosis as you go through this semester. The best way to think of your differential diagnosis is to look at it as a list of all the diagnoses that could possibly cause a person's symptom or symptoms. I like to use the UpToDate app or another app called MD on Call when developing a list of differentials. As you gain more experience, you will be able to mentally remove certain diagnoses from specific patients' lists due to their history, exam, and diagnostic data. This will come with practice, so don't be upset if this doesn't come right away. There are many methods that we will be utilizing throughout this program to help you fine-tune your differential diagnosis skill. Typically, you want to narrow down your list to 3 to 4 possible diagnoses. I included a list in the notes section of this PowerPoint. As a provider, you would use the patient's exam findings, history, and diagnostic studies to narrow your list. You would voice your list and why you chose those diagnoses during your case presentation. You can include important facts that may make you lean towards one over the other. Some example differential diagnoses for left lower quadrant would be diverticulitis, colitis, constipation, irritable bowel syndrome, cystitis, hernia. Looking more towards gynecological, it could be an ovarian torsion, a ruptured ovarian cyst. Looking towards male could be a testicular torsion. Those are just some of the examples that could be on your differential diagnosis depending on how the patient is presenting. The management section allows the provider to know what has been done or is being done. This may be you simply saying the patient has not used any form of treatment for this complaint, or you could state, patient with left lower quadrant pain visited the ER on date and was given Tylenol 500 milligrams PO, PRN, Q6 hours for pain. Patient has taken 3 doses and states this dose does not help. Had an abdominal pelvic CT scan at that time that showed no acute findings or explanation for pain. Patient was discharged with a referral to general surgery in the next week for possible colonoscopy and instructed to follow up with her primary care provider. Once you reach the end of your patient presentation, it is good practice to state any final comments, including a summary if you covered a lot of information. As you gain more experience, it will be very appropriate to give your suggestion of treatment and/or plan of care for the patient. This allows your preceptor to give you feedback and determine your knowledge level. And again, this is something that you may not necessarily feel comfortable to do right at first, but as you get farther along in clinical and as you are continuing to learn during this program, you can give a list of some of the treatment options that you think would fit appropriately for a certain patient and see what your provider says. It'll be good for you to hear the rationale on why or why not they would choose that form of treatment, as that'll help you later on in your own practice. Although presenting a patient case may be an intimidating thought, remember that you are painting a picture of what is going on with your patient so your provider can understand their background. You will not be perfect at this first, but with practice they will get easier and easier. At its core, a case presentation functions as an argument. Some final tips I have for you are: 1, be confident. You've worked very hard to get to where you are. 2, minimize fidgeting, so stay on track so you look organized. 3, feel free to use notes, especially at first this may be helpful. And then 4, be honest. Give your honest observation and opinion of your patient so that you and your preceptor can make an accurate, if I can talk, accurate plan for your patient. Okay? Let me know, guys, if you have any questions. This is just a brief overview. I did include an example in Canvas for you to look at, too. I thought it was a pretty good example from another nurse practitioner student. So feel free to view that. If you still have questions afterwards, of course, always feel free to message me either through Canvas or through email. Okay? Thanks, guys.